Hello and welcome viewers. You're watching Perspective with your host Kriti Mishra. Today we'll take a closer look at the National Nursing and Midwifery Commission Bill 2022. The bill provides for regulation and maintenance of standards of education and services by nursing and midwifery professionals. The present law governing the nursing professionals, the Indian Nursing Council Act, was passed in 1947. The Indian National Council is responsible for ensuring the basic nursing educational standards, recognizing nursing qualifications and prescribing entrance requirements and curriculum for nursing courses. On 5th of November 2020, the government proposed removing the INC Act and replacing it with National Nursing and Midwifery Commission Act, which proposes a common entrance test, a national register, mandatory registration and a temporary license for foreign nationals who are qualified nurses and midwives to practice in India. And for deeper insights on the bill, I'm joined by an illustrious panel of guests. Joining us through virtual platform, Professor Dr. Bimla Kapoor, Chairperson, Review Committee Development of Nursing Services, Ministry of Health and Family Welfare. It is imperative to inform our viewers that this bill has been drafted under the chairpersonship of Dr. Bimla Kapoor. Pleasure having you on the show, ma'am. Also joining us, Dr. Dileep Kumar, President, Indian Nursing Council. I welcome both of you to Sansad TV and thank you so much for joining us. And Dr. Kapoor, let me begin the program with you. The present law governing the nursing professionals, the Indian Nursing Council Act, was passed way back in 1947. Since then, our requirements have changed. We have new challenges at hand. Take us through the importance of this proposed legislation.
Thank you, Deepthi. I think the Indian Nursing Council Act, which is there, 75 years old, has been going through a lot of revision, lot of changes, ad hoc changes. And I think the standards were being maintained as much as possible with whatever infrastructure and whatever facilities are there. But however, a draft was given to us by the Government of India, Ministry of Health and Family Welfare. And the biggest change is that earlier bill was Indian Nursing Council Act. But now it is, the document says Nursing and Midwifery Commission. Uh, Nursing and Midwifery Commission. So midwifery being a very, very important part of the nursing, and we give RN, RM to our nurses rather than other countries, because every nurse in our country becomes RN and RM, registered nurse and registered midwife. So this is the biggest change, that the bill is now called as Nursing and Midwifery Commission Bill. That's the biggest change. The second thing is that it has provided clarity on many definitions. Not that the definitions were not existing, but it has provided clarity on public health, community health, public, also on nursing practice, nursing scope, clinical nursing, nursing care. Many of the aspects are there, many definitions are there, which are elaborated in this act, so that whoever is going to, on this commission bill, whoever is going to do it, read it, will also get an idea what is to be read and how it is to be read. Interpretation becomes easy. Also, the nursing, why nursing practice is added, because nursing education is always there, but nursing practice, though it was being administered, the norms were being established, but the nursing practice word was not used, and that's another the highlight of this bill. Of course, register was being maintained earlier also, but now there will be improvement. Of course, the things get improved over a period of time. Emphasis also placed on clinical nursing, community nursing, the nursing practice, nurse practitioners in various specializations, and nurse patient ratio, and various other norms, so that we are able to provide a clear cut guidelines to the people who are starting. It is there already, but now it has been defined, or it has been little more elaborately mentioned. Also, we have created autonomous bodies. All the chairperson will be only person with nursing and midwifery qualification. Whether it is MSc, PhD, it has to be nursing and midwifery qualification. Not anybody else would be the chairperson. Even members, the bill has very clearly mentioned the chairpersons, the committee members in all, from all the 6 states, how it will be done on rotation, and also the state, at the state nursing council, who all will be the members. Now, also suggested that counseling will be done at a state level by the State Nursing Council under the guidance of the National Nursing and Midwifery commission at the headquarters, but guidelines will be provided. The other category which was asked that we should introduce was healthcare associate, because they are called as nursing associates. We said no, they
That's
have
right.
to be healthcare associates. We also recommended the exit, common entrance
Yes.
exam. Now, past 1 year, 2 years, NEET has been, advocated. The problem is in NEET, we are not able to get the cutoff, the good cutoff for the nursing. So we have proposed the common entrance examination all over the country, and also the common exit. Exit examination is the one which has been thought over by all the leaders in nursing in the country, but we have seen that it will be possible to do it. And for ANMs and LHVs, we said it will be skill-based exit examination, so that we assess their skills. Then, of course, as you mentioned, mutual recognition. Already, I think Indian Nursing Council has done for two countries, but now it is proposed that reciprocal registration will be done so that people don't go through a problem. Already, their common, list is. The register is being maintained, but it will be mandatory that there has to be information of the number of nurses, and it has to be listed on the same day, same time, to the National Nursing and Midwifery Commission, so, and also the State Nursing Commission. Now, there are many categories we have proposed, but we reduced it to 7 categories based on ISCO. So, I mean, there are many highlights. Another highlight is that out of 46 members, we have got only two non-nursing members, and we have got four non-nursing members as ex officio. The rest are all the nursing members of the various category from various fields, which I think will be listed. In the 10 chapters which are highlighted, we have got nearly 56, more than 56 regulations. Rules will be there, and there are regulations. Now, people mix it up, why this is not there, why this is not there. That becomes a part of regulation. So regulation will be elaborately done, so that it gives guidelines to everybody. There are some regulation already existing, like examination regulation is existing. There are recruitment, some of the regulation existing, but these regulations, rules will be by the government given to us, and the regulation will be developed by the nursing professional based on already available regulations with the Indian Nursing Council. So
Right.
these are some of the very important highlights which I would like to bring it. And also we added one schedule, and this schedule of course was not put on the public domain, but we had highlighted. Same is State Nursing Council. The whole State Nursing Council chapter was missing. So we had to tell them that the State Nursing Council chapter was missing on the public domain.
Yes.
Of course, it will be incorporated, because you cannot work in country like India only at the National Nursing Commission. You have to have the State Nursing Council, which we already have, and this is the
Absolutely.
State Nursing and Midwifery Commission. That is another highlight. So these are some of the very important points: the exit examination and entrance exam, common entrance examination. That's very, very important we are highlighting. And also the nurse practitioner in various categories, various
Absolutely, ma'am.
specialization, not that also is significantly highlighted.
Absolutely, ma'am. That's a very important component as far as standardization of education is concerned. And thank you so much for taking us through important highlights of the bill. And coming to you, Dr. Kumar, I'd like to understand what are the challenges that need to be addressed with regulatory reforms for improving nursing education in our country.
I think this proposed bill is addressing the various issues and challenges which we are facing in terms of the maintaining the uniform standard of nursing education all over India. I think India is the only country where you have a one syllabus which is being prescribed by the Indian Nursing Council. Now it is going to be called as National Nursing and Midwifery Commission, which is implemented all over the India. So therefore, this there is at present with the existing legislation what we have under the Indian Nursing Council Act, there are a lot of the overlapping function between the state nursing councils and the Indian Nursing Council. I think that is one of the important thing which has been addressed in this proposed bill. Overlapping functions of the between the state nursing councils and the Indian Nursing Council has been removed. That will facilitate for the smooth functioning of the whole legislation which is going to be passed by the Parliament. And other important the issue which has been addressed in this this legal empowerment, because at present the existing Indian Nursing Council is not having a legal empowerment for the nurses and the midwives to practice. Especially our existing Indian Nursing Council Act only covers about the education aspect, the clinical practice. That means scope of practice, which is very, very important. That scope of practice has been included, which will facilitate for our nurses and midwives to have a legal empowerment. So this bill is going to provide that very important where the nurse practitioners, which is we have already started the nurse practitioner critical care program, so which is being accepted in the healthcare delivery system. So we are going to have a different specialized practitioners program in which various protocols, competencies, procedures which our nurses and midwives are going to perform will have a legal empowerment with this proposed bill. And similarly, the one of the thing which is commonly we have a problem is when the Parliament asks the question, how many nurses and midwives are there in India?
Yes.
We give the figure of the cumulative figure from the 1947 to date. I think this bill is very clearly has mentioned that the live register. So the live register, we should maintain the live register, which already Indian Nursing Council has maintained the 1 million nurses. The data linked with the Aadhaar has been implemented. So that has been a further fillip in this proposed bill. That means in future, the nurses who have gone abroad, their names will not be there. The nurses who have been died, their names will not be there. So we'll have at any point of time the live register that will facilitate for the effective nursing and midwifery planning at the district level, at the state level, at the national level, and also various specialization which has been reflected, which will be reflected, so that at any point of time like COVID-19, we had a challenge of identifying how many nurses and midwives are there in the district for the COVID care. So this our live register, the nursing registration tracking system, which the Indian Nursing Council has already done it and which has been reflected in the proposed bill, will facilitate for the effective identifying the nurses and midwives before appointing in the corporate hospitals or in the and also to find out this live register about their whole specialization before appointing them. So therefore, this this whole another important is there is a full-time members have been included in this proposed bill. At present, we never had a full-time the president and the full-time members. And these full-time members will facilitate to take quick decisions and also to facilitate for the improving the monitoring the system of the quality. And also another important reflection has been made in this is that the state commissions, the existing state nursing councils have been named as the state nursing and midwifery commissions. They have a role in the conducting the competency-based tests. So that is the simulation and other the competency-based tests that is going to help for the improving the quality of our nursing practice at various levels. So that is a significant component has been included.
Absolutely, Dr. Kumar. But Dr. Kapoor, the absence of nurses from health systems' decision-making bodies and lack of long-term planning for nursing and midwifery has led to the capacity gap, perhaps. Now the bill says that on a biennial basis, the Ministry of Health will rotate 10 nursing leaders, 5 each from nursing and midwifery services and educational institutes of excellence. Do you think this proposed legislation and this provision will go a long way in addressing this critical issue?
I think the discussion had been so much on this commission bill that definitely that it is going to really remove some of the hurdles. In the other countries about Indian nurses is very, very high.
That's
We
right.
all know it. Honorable Prime Minister had also acknowledged it, and everybody has mentioned about it. Rotation is made very thoughtfully so that, there are good ideas which come up when we do the rotation, but it is not rotating everybody at a time. I think it's worked out, and I mean, there may be some difficulties, but let us see that the change always is good to see that innovations are there, good ideas are there, good thoughts are there.
Dr. Kumar, I'm completely out of time, but I'll give you the floor for your closing remarks.
I think this some of the issues and challenges which you are mentioning about that. I think this advisory committee, which has been proposed in this in the bill, that advisory committee, which is represented by each state, they will be able to bring out the issues and challenges each state is facing. So they can bring out definitely. This bill is providing for the Ministry of Health to give directions to all the state commission for implementation and. With this advisory committee which has been suggested in this proposed bill will facilitate to capture the issues and challenges, and the solutions are definitely discussed at the national level, and those decisions can be conveyed to the state governments for the implementation. I think this whole the new nursing and midwifery commission bill, which is definitely is going to solve many of the issues and challenges which we are facing in the nursing and midwifery system in India.
Right, absolutely. So we can conclude that the National Nursing and Midwifery Commission Bill 2022 is a hope for Indian nurses that it will augment the growth and autonomy of nursing and midwifery profession in the country. On that note, thank you so much for joining us, Dr. Kapoor and Dr. Kumar. Well, viewers, that's all we had for you in this edition. Thanks for watching and stay tuned to Sansad TV. Goodbye for now from my side.